I am so excited because we have Susan Galeas, and she is the CEO of the Southland Chapter of the Alzheimer's Association.
Right, right. It's the California Southland Chapter.
California Southland Chapter.
We had to make it really difficult, Susan.
Yeah. Okay. But I'm really excited to have an opportunity to interview Susan because, as you all know, so many people are struggling with Alzheimer's disease, either individually or because they're caring for somebody who has this disease, or maybe just having to witness a person that they love in the throes of the disease. And this association is dedicated to not only doing fundraising for research, but actually providing hands-on instruction for caregivers, and we will get into that, support groups, and many other services. And I'd like Susan right now to introduce herself and to also talk about some of the services that the association can provide to any of you who are watching this.
Thank you so much, Susan. I'm pleased to be here this morning and thrilled that you are so aware of what we do for our communities and willing to share this with the people that you communicate with. As you mentioned, we are the Alzheimer's Association California Southland Chapter. We have responsibility for programs and services, advocacy, outreach, and research in the Los Angeles, San Bernardino, Riverside, Inyo, Kings, Mono, and Tulare counties.
Wow, the Southland.
Yes, truly the Southland.
Yes.
We have 5 locations where we offer programs and services. Here in Los Angeles on Wilshire Boulevard, we have a Greater East Los Angeles location, a San Fernando Valley location, a location in the Inland Empire, and one in the Coachella Valley.
So you have physical locations, because I know that maybe some of you have done a Google search and looked for information from the Alzheimer's Association, but you actually have physical locations that you just mentioned that people can go to.
Yes.
And when they go there, what can they expect?
Well, they can expect, one, to have direct response to whatever their question or their need might be. Depending on what that need is, we can connect them either with internal resources or with external resources. So if it is someone who needs perhaps care consultation, they have a question related to their person living with the disease, or a question about whether someone they love is exhibiting symptoms that may or may not be Alzheimer's or some other form of dementia, we can work with them directly and help them either identify a physician or work with their own physician to get through the process for some sort of diagnosis. We can guide them in any one of a number of ways to help them through the progression of the disease if their individual is living with the disease. We work directly with people who are diagnosed. We have early stage support groups.
That's excellent.
We have, and those actually are for the person in the early stages of Alzheimer's or dementia and their family caregiver, and they come together. And then as people progress through the disease, we continue to provide support groups for the family caregivers. And we work with partner organizations throughout the communities that we serve, because we can't certainly provide all the resources that people need.
Right.
And there are far more people living with this disease and caregivers who have needs than we have the resources to provide support groups. So we work with a number of organizations, for example, Lisa's Place, which also provides support groups in the communities we serve. So we work with them to find the best fit for those individuals and for their families. We can help with just about any question or any need that they have related to Alzheimer's or dementia.
Before we started the interview and the cameras were rolling, you and I were talking about caregivers and their understandable lack of experience in providing care to somebody who's got Alzheimer's disease. And I know as a geriatric care manager, sometimes when I'm managing the caregiver that's caring for my client, I really have to pull them aside and ask them whether or not they understand that my client has Alzheimer's disease, and to understand that when they ask, for example, to go down to the mailbox 3 times, that the person doesn't remember, and that they need to validate that person's feelings and redirect them, and always err on the side of being kind to the person that you're trying to help. But of course, sometimes people who have Alzheimer's disease or other forms of dementia develop some more difficult behaviors. And so you were telling me that you actually do caregiver training here.
We do. We provide education and training both for family caregivers and for professional caregivers. We have a program that is evidence-based for family caregivers called Savvy Caregiving, and we have actually converted that same program into a different model, a little more condensed model in Spanish called Cuidando con Respeto. Through those programs, we work with family caregivers to help them better understand the disease itself, how the disease impacts the brain, why their person is behaving in the way that they are, how to better respond, how to take care of themselves, which is critical because in many instances, caregivers are so focused on caring for the person they love that they forget to care for themselves, and they end up getting sick and sometimes dying before the person with dementia. So it's really important for them to learn how to take care of themselves so that they can be more effective as a caregiver. And the program also provides very basic skills, like how do you lift someone who has become dead weight without injuring yourself? How do you deal with very erratic or perhaps aggressive behaviors and keep that person safe? What do you do about wandering? So those types of things are dealt with through Savvy Caregiver. And then for the professional caregivers, we can go into organizations, both public and private organizations, hospitals, care facilities, and work with their staff so that they better understand how to be more effective in working with patients.
So Susan, this is a nonprofit.
Yes.
Do individuals who would like to avail themselves of these services have to pay to go to a caregiver support group or to caregiver training?
We never turn anyone away due to inability to pay. In most of our programs and services are free. We do with organizations that have capacity for support. With the professional caregiving training, we do charge a fee. But in the context of the corporate world, our fees are nothing in comparison. And for individuals who are family members, it's free.
Great. Having said that, I understand that fundraising for Alzheimer's research is a little bit troublesome in this day and age, even though the Obama administration has dedicated funds for research. Could you speak to that?
Sure. Well, I'm actually going to address two things related to fundraising.
Okay.
Because we're at a point in time when we know there's an exploding number of people as the baby boomers last year began turning 65, and the numbers for those individuals who will develop the disease are about to just skyrocket. We're going to need to provide the programs and services to those people while we're also trying to raise those critical dollars to fund the research that will hopefully one day find the cause, a treatment, or a cure for this disease.
And today I just want to make sure that everybody who's listening to this understands that there is no cure, contrary to what you might have read on the internet or seen or heard. There is currently no cure. That doesn't mean there's not hope for a cure, and I am very optimistic about that.
With every clinical trial that makes it to the third phase and maybe is not successful, we've learned something.
Yes.
So in many people's minds, we've had a number of failures, but in our minds, they have been successes because they've taught us something we didn't know before. So fundraising around research is very important. The most important funding for research comes out of the National Institutes on Health. And when you look at the fact that Alzheimer's is the 6th leading cause of death in this country, and it's the only one of the top 10 causes that can't be prevented, slowed, treated, or cured, we know we have an epidemic that is about to bankrupt this nation.
Absolutely.
And unfortunately, people really aren't embracing that. Due to our organization and other advocates around this cause in the country's focus on public policy and advocacy, we've seen some transition in our capital. The legislators in Washington, D.C. have finally kind of woken up and are embracing this cause as important, and we've reached that kind of pivotal moment when things are starting to happen. We're at that tipping point. The fact that most other diseases in those top 10 causes of death are funded by the NIH kind of at this level, the 1 billion and up level, and their rates of death are decreasing. Mm-hmm. And Alzheimer's gets about $500 million of funding, and our rates of death are escalating.
Do you attribute that somewhat to ageist beliefs about disease processes and who they impact most?
Mm-hmm. I think so. The majority of people who develop this disease, any form of dementia, are older. They're over the age of 65.
Right.
That being said, we see a number of people with Alzheimer's who walk through our doors who are exhibiting symptoms and being diagnosed in their 40s and 50s. They have young families. Mm-hmm. I have a 22-year-old daughter. I know that we don't know if this disease is caused by genetics or if it's caused by something else. There's the potential I could develop the disease. There's the potential that in 20 years, 30 years, 40 years, she could develop this disease. Either way, if I develop it, if she develops it, it will devastate our family.
Right.
So she can't afford to care for me, and I can't imagine having to care for her.
Right.
So it's going to be really important for everyone to recognize that this disease is not a normal part of aging, and that as we have developed the medical technologies and medicines that allow us, and the knowledge that allow us to age and to live longer, healthier lives for every other part of our bodies, that the chances of developing this disease are greater. So it's critical for everyone to get on board.
So what are some avenues for people to participate in fundraising, whether it's $5 or
Mm-hmm.
$5,000? Every dollar counts, as is the case with any organization that you want to support or any cause. But having said that, how do people get involved? Can they go on the website and click a button and safely say, I want to give you $5? We know that there's Alzheimer's walks. What else can they do?
There's nothing they can't do.
Okay. We can become politically active, which I see
Yes.
in every single one of my videos, which, again, you'll always hear this. The last chapter of my book is, we used to burn our bras, didn't we? Because that's how we get things to change in this country, is by getting up, standing up, and using our voices. But aside from that, what can they do?
Well, they can, one, we live in the day of the internet.
Yes.
It's reality. When we want to find something, we no longer go to the phone book, we go to the internet. So if they have any need around this disease, they can go to alz.org and get questions answered. They can also find out about upcoming events. For our chapter, our website is alz.org/SoCal.
Okay.
And there are 5 other chapters in the state of California as well. So we all work very collaboratively around things, especially like Walk to End Alzheimer's. So if you go to our website, you can find walks throughout the state of California. There's no excuse for not getting involved. And we have walks for our chapter in Los Angeles, Long Beach, the San Fernando Valley, the Inland Empire, the Coachella Valley, Santa Clarita, and also starting in the fall in Visalia. So
Excellent.
lots of opportunity. It costs nothing to walk, but we encourage everyone to fundraise for themselves as a walker or for their teams. And we have other events. We have very high-profile events like Sardi's, which Lori and Peter Grad graciously host every year. And we have an event coming up. One of our board members, Susan Disney Lord, is hosting an Unforgettable Evening, which is a small, intimate, high-profile event. And we have opportunities like the longest day. June 21st is the longest day, and it represents what caregivers experience every day. Every day is a 36-hour day for caregivers. So the longest day, people can do whatever they love and get people to sponsor them. So if they are readers, they can have their book club sponsor each person in their book club, maybe reading for an hour. If they're knitters, they can take turns knitting. If they're hikers, they can hike. You know, they can be as creative as they want.
That sounds like a really good day for us to do our Dancing for the Memories. I will be putting on that event in the South Bay, so if you have any questions about that, you can email me. You have my email address. We will be doing Dancing for Memories and donating all of the proceeds to the Alzheimer's Association.
Yay, you're so sweet.
So, Susan, many people have heard or read that the Obama administration has dedicated funding for Alzheimer's research. Can you speak to that, please?
Certainly. I think I mentioned earlier that there are changes in Washington, D.C. around, they're embracing this disease and this cause as is important, and recognizing that we can't afford not to invest in this disease. As a result of those efforts, the National Alzheimer's Project Act was signed into law by President Obama, and it directed a focus on this disease and identified 2025 as an end date for identifying a cause and a treatment for Alzheimer's. And that's the first time that's happened. As a matter of fact, when President Obama spoke recently in his State of the Union address, he not only mentioned the word Alzheimer's, but he talked about brain mapping, which is beneficial not only for our disease, but every other disease that's out there related to mental health. So the President has included $100 million in the 2014 budget, which hasn't been approved yet, $80 million towards research, and $20 million for care and education. This is the first time that Alzheimer's research at that level has been included in a president's budget. It's incredible.
It is incredible.
And it wouldn't have happened without all the advocates that we have who call on their representatives regularly. We have ambassadors across the nation through our organization who make sure that they're driving home to all of their congressional representatives and the senators the importance of this message. And again, we're seeing progress, but it's still not enough. It's not enough.
Which, again, is why we need to become politically active. We can't just be complacent and think that change is going to happen and the government will one day wake up and understand that there is a looming crisis, not only with Alzheimer's disease, but related thereto, the care and the delivery of services to a rapidly aging population.
Right. And anyone who wants to get involved in advocacy, all it takes is a computer and a few minutes of your time, maybe on a weekly basis. They can contact us. We can sign them up to become an advocate for the Alzheimer's Association. We send them emails with messages and who they need to email in turn. We make it really easy so there's no excuse.
I love that.
Yeah.
So tell me, one last question. What is the phone number to this brick and mortar facility in case somebody who's watching this would like to come?
They can call our 24/7 helpline, 1-800-272-3900, 1-800-272-3900.
Thank you very much for this, and I can't tell you how much I appreciate you being willing to talk to my viewers and provide them with this really, really critical information. Thank you.
Thank you, Susan, and thank you for all you do on behalf of the people we serve.
Thank
it's
you.
really appreciated.
Thank you.